Just asked Pilar for a bio, but we thought we'd just summarise it by just saying that Pilar is one of those extraordinary nurses who has great commitment and great expertise and has worked with us for a couple of years. We've got to know Pilar quite well and we just think she's fabulous. So Pilar's going to present on some of the work they did last year with the mentoring. So could you welcome Pilar Otero from the Illawarra Shoalhaven Medicare Local.
My name is Pilar, as I was very nicely introduced. Just a little bit of background about myself. I've been a registered nurse for 34 years, hospital-based trained, so that goes to show my age. In that time, I mostly worked in the acute care setting, in intensive care, coronary care, etc. My introduction to general practice nursing, I just thought I would share with you because it was, and I'm sure, you know, we talk about practice nurses being, can you hear me? Sorry. Is that better? Sorry. We talk about general practice nurses often feeling isolated, all alone. My introduction to practice nursing, I had moved to the Sunshine Coast. I'd never worked in general practice and I applied for a position. I had not had an interview. I got a phone call from the nurse manager of a corporate company that owned quite a few medical centres across the Sunshine Coast and Brisbane. And the phone call was, Pilar, we've got, haven't met you, looked at your resume, you haven't had any general practice experience, but there's something about your resume that we thought we'd give you a go. So I was expecting I'll get an interview. Instead, I was asked if I would have a half-day orientation to a general practice that in an area that I didn't know. The practice manager / nurse was going on a week's leave and they didn't have anybody to replace her. So it was like, right. I had been lucky enough to have one shift. I was on a casual pool for another medical centre, so I'd had one shift in a general practice where I was very quickly introduced to immunisation for 6-week-old babies. I had only ever given injections to adults. I was introduced to sterilisation, which I'd never had to do in an acute care setting because we had our sterilisation departments. So off I went for my half-day orientation at this general practice and very quickly was thrown in. This is how we do our sterilisation, this is how you record it, this is our medical software. Luckily it was the same software as where I'd had my one day. This is how we do our recalls and reminders, and we'll see you on Monday. So that was my introduction to general practice nursing. I was then there for a week. I interrupted the doctor many, many times because I wasn't going to give any vaccinations or do anything without the doctor being there. I think he sort of, eventually I earned his respect. And at the end of the week, I was given a phone call and saying, well, yes, you've got the job. How would you like your own clinic? So that was my introduction to general practice nursing. I then proceeded to work in general practice for 8 years, which I thoroughly enjoyed. I found that my acute care background came in very, very handy, but it was amazing how suddenly you had to know a little bit of everything. So I thought I'd just share that with you because that's exactly how I felt when I started in my new general practice. I was isolated. I didn't have anybody that I could call to say, hey, you know, am I doing this right? As I say, one of my most frightening experiences was giving a vaccination to a 6-week-old baby. So I just thought I'd share that with you because I think that was why when this project became available last year, I was extremely keen to become involved in mentoring and leadership of nurses working in general practice because I genuinely know how that feels. So last year we were lucky enough to be involved in a nursing in general practice demonstration project that was funded by ISML. We had determined in 2012, we did a survey. Sorry, I work with Medicare Local in the Illawarra Shoalhaven area and I'm the team coordinator of the practice support team there, and we do quite a lot of things across our board. Our portfolios go across CVC programs, everything that relates to Medicare Local. But through a needs assessment we determined that the nurses within our Illawarra Shoalhaven area, and thank you for those guys that are here to support me. Thank you. It certainly found that nurses felt that they were lacking in leadership, in mentoring. They felt that when the transition from the divisions of general practice to Medicare Locals joined, that the nursing and general practice program had sort of been lost a little bit in the works, so they were looking for some leadership. So we were very keen to do this project. The aim of our project was to improve and develop opportunities for leadership and for mentoring for all primary care nurses within the Illawarra Shoalhaven Medicare Local. Oops, sorry guys. Some of the things that, as I mentioned, that we identified that was that they were looking for a team of nurse leaders to help them to get back on track and to start to increase the networking amongst the nurses in our area. They also felt that they needed to understand the competency standards, and we've heard a lot about that in our sessions yesterday, particularly the advancing role of nurses working in general practice and where we're going. We wanted to see what we could do to reduce isolation, to improve confidence, and Anne's mentioned that a lot of nurses, that's all we're lacking is the confidence. We're all leaders as far as I'm concerned in the work that we do, but we just need to improve our confidence and to be able to empower ourselves to be advocates for the roles that we do. So some of the things that we did as part of our project was we put an expression of interest out to all of the nurses working within the Illawarra Shoalhaven area to be involved in a 2-day mentoring and leadership workshop, which was quite intensive, and our beautiful Liz Meadley ran that workshop for us. We then got 10 nurses, so our group consisted of 10 nurses. We would have liked a little bit more, but 10 nurses it was. And they came and attended our 2-day extensive workshop. So the first day was looking at mentoring. The first day was looking at leadership skills and how to improve our leadership skills, how we could develop this group to be able to get that information and to get that leadership happening within our local nurses. The second day consisted of mentoring and looking at how this group of 10 nurses could potentially work together to empower nurses out in our local district. So they formed what we looked at the model, looking at the mentoring circle model, because what that meant was that all the people within that group were mentors and mentees. So they were all able to support each other, learn from each other, and share experiences. The group became very active during the project. They met monthly. During that second day of training, with the assistance of Liz, they developed agendas, they developed a terms of reference, they developed how the group was going to work. They met initially monthly, and in those meetings they worked on how what strategies they were going to put in place to be able to get that information out to the nurses and how to get nurses more involved. So one of the things we had been decided and certainly identified was that the nurses needed education and leadership skills. So we ran several workshops during our program. And the first one, as I mentioned, was mentoring and leadership, a rewarding partnership with Liz Meadley. The second one we looked at was advancing the role of primary care nurses, and in that we had Liz Meadley again was our focus speaker, but we were also lucky enough to get Professor Elizabeth Halcombe, who you may have heard speak yesterday. She's from the University of Wollongong. We also managed to get another professor, Professor Andrew Bonner, who is one of our GPs that works in our Shoalhaven area, and he's very, very involved in research. So what we wanted was to enable the nurses to be able to look at the roles that they were working in, looking at their at their competencies, and it was interesting with this particular one how we actually asked the question, how many of you nurses feel that you're working at an advanced level? And amazingly enough, not a lot of them felt they were, but when we started asking the questions, they were 90% of them were doing all of those things. They were doing chronic disease management, they were running clinics, they were doing the health assessments, they were assisting the practice to grow. So that was a great one. And then the third workshop we had was run by our lovely Anne Rolfe that just presented to you. And that was on mentoring, what your practice needs and how to do it well. And one of the things that had come across throughout the project, that a lot of the information and education that we're giving to our nurses, and I know this has also come up in the conference, is that we need to not just get the information across to nurses, but we need to get it out to the entire practice setting. So we need to involve the frontline receptionists, we need to involve the practice managers, and we certainly need to involve and engage the general practitioners, because without their support we can't continue to grow as nurses in leadership roles. So at that workshop we invited everybody. We invited practice nurses, we invited GPs, we invited practice managers, and we got a great response to that workshop. And it really clearly did show that, particularly the GPs, the feedback we got was that it was a great workshop, and that they would go back and look at things a little bit differently within their practice. And the last one was clinical nursing leadership from our Stuart Constable, and of course everybody in this room knows Stuart. So we were extremely lucky to have these 4 excellent workshops for the local nurses within our area. Just a little picture, I thought I'd show you a picture of our mentoring circle. Now, the group started off with 10, and through health and personal reasons it sort of dwindled down to 7, but the group of 7 nurses were very proactive in what they were doing. And we talked about having a nurse on our Medicare Local board, and of course Ros Rolliston at the front is one of our Mentor Circle members, but she's also on the board of directors at the Illawarra Shoalhaven Medicare Local. So we were extremely proud to have her on board. Just to give you an indication, the Illawarra Shoalhaven area is quite large. So one of the problems, I guess, that we came across with the mentoring circle was that we had to cover such a large area. So you can see on the map, the Illawarra Shoalhaven goes from Wollongong. You probably can't see the map very clearly. So we cover quite a large area. When we're doing our education for nurses, and when the nursing group, the mentoring circle, was looking at how they could get to their local nurses, it became a problem. So it was then decided that we would develop a north and a south group, which would get together and present to local nurses and try and do local networking every 3 months. So this was after the project. And then every 2 months the entire mental circle group would get together and would bring back that information. So the southern group were particularly active during and have continued to be active. They've presented several educational sessions for the nurses down in the Shoalhaven area. The Wollongong group is starting to get that a little bit more established, but they've had networking sessions together with the assistance on occasions of Medicare Local. One of the things I was very proud of with the group is that they did become self-sustaining. They became self-supportive. They organised all of this stuff themselves, and they, in their own time with no remuneration. So I was very proud of the group that they continued this. And are still continuing. One of the things that they're now looking at is, so as I just explained, this is how the group worked. They facilitated local networking groups. All copies of agendas and minutes were sent out to the entire group, and the way that it worked was each time they had a meeting, there was a chairperson and a person that took minutes, and then at the next meeting it was the person that had taken the minutes that would chair the meeting. So it worked out very well. And the project coordinator, that was myself, we were invited we were only to attend the meeting by invite. Now the group has decided that they really want to venture off into a different area, and they wanted to focus more on leadership. I did a 12-month impact evaluation on the group itself. So remember that the group had now dwindled to 7. And these were some of the questions that we asked following the 12 months of them having had their initial 2-day workshop. And as you can see, what are the knowledge and skills that you've used following the workshop? Have you implemented any changes? Did you receive the support you needed by your general practice and by Illawarra Shoalhaven Medicare Local? What impact has the training had on your professional and personal goals for the future? And these were just some of the results. As I say, it's a very short group, a very small group, so putting 50% was probably not a good way to look at the results of this. But essentially, half the group felt that they had received all the support that they could get from their GP practices, from their peers, from Medicare Local. Some of the group felt that they hadn't received as much support as they could have from their GPs and from their nurses. And this is where we sort of looked at needing to really involve the entire practice when we were wanting to support nurses with leadership and mentoring. There was increase in confidence, improved self-awareness. They were more eager to implement changes. The communications between staff had improved. So we were quite happy with that. Where to from here? As I mentioned, the group is wanting to transition to more of a leadership role with increased input into ISML's Nursing in General Practice program, which we are very, very excited about. The group is now encouraging more nurses to, they've encouraged nurses to be more involved. And we do actually have a few more members on our team now, so there's 11 in total. Out of that, we have 2 nurse practitioners that are working in general practice. And we're looking at facilitating a meeting with the circle members and all nurses working in general practice to see what Medicare Local can do to continue to support our nurses working in general practice. I hope that that sort of summarised what we did, but I'm a big believer in nurse leadership and mentoring, and I think we need to continue supporting, we need to continue talking, and we need to get our voices heard. And one of the resources that Lynn Walker and AMLA have put out is marketing yourself. And I am a big believer in that, guys. We can all do it. You need to sell yourselves. For those of you that don't have the support from your practice managers and GPs, start looking at how you can, because you're contributing an awful lot to the nursing profession. That's it, guys. Thank you.